Our next presenter is Mark Loeb from the Faculty of Health Sciences at McMaster University. Mark Loeb is internationally recognized in the field of infectious diseases, clinical trials, and epidemiological studies. He is distinguished for his work on influenza vaccination and herd immunity in Canadian Hutterite communities and for a pivotal trial on respiratory mask protection against influenza. He has conducted influential clinical trials on prevention and management of infections in nursing home residents.
Hello, my name is Mark Loeb. I'd like to begin by thanking the organizing committee for allowing me to present here today. So the title of my presentation is called Learning from the Hutterites, Prevention of Influenza and COVID-19. So as a reminder that no one needs, unfortunately, is the epidemiology of COVID-19. As we know, it's increasing, particularly in Alberta, Quebec, and in Ontario. And we really need more data, specifically about community transmission, to help prevent the further spread. And there are key questions. One question is about the role of children. So there have been public health studies through contact tracing that suggest that children are less likely to get infected with COVID-19, but it's not really based on carefully conducted prospective cohort studies. Another question is the correlate of protection. In other words, that we know that there's data that after COVID-19 infection, there's a robust T-cell and antibody response. And even in people who aren't infected, there's some sort of response. But the question is, to what extent does this protect individuals and actually even entire communities? Or can that question be answered? Another question are the modes of transmission. To what extent is it large droplet versus aerosols that are just sort of breathed in versus direct contact? So there's a lot of controversy. There are super spreading events such as this outbreak in Washington State in a choir, where some people look at the same data and say, well, it's obvious aerosolization. Other people think it's just person to person based on droplet or close person contact. There's also estimates of physical distancing, and it's really important to look at that at a community level. As well, there have been well-described studies, cohort studies in entire communities. For example, this one was in Tecumseh, Michigan, looking at influenza infections in various age groups, showing that children get high attack rates, but the outcomes of hospitalizations and deaths, unfortunately, are in older individuals. And we really need this sort of study, this sort of a prospective community, entire community study for COVID-19. So the goal of this study is to understand community terms of COVID-19 transmission. And we're conducting the study in the Hutterite community. So in Hutterite colonies in Alberta, Saskatchewan. Hutterites are Anabaptists that live in colonies of 80 to 120 individuals. They're relatively homogeneous. Roughly a third of the population is children. And there are a lot of outbreaks in Hutterite colonies. This is a map of colonies in Alberta, Saskatchewan, and Manitoba. For the last 15 years or so, we've been doing cluster randomized controlled trials in this community, randomizing children to either influenza or control, for example, in this study, and finding a very high rate of herd effect with immunization of healthy children against the flu, about a 60% protective effectiveness, which is the same thing as the shot in the arm. As I mentioned, there are a lot of outbreaks in Hutterite colonies, so we've been tracking this over the years. So it's really almost explosive outbreaks that occur. So it's very important to actually study this both for the benefit and with the Hutterite community, but also to generate data for the rest of the world. So our cohort study involves 20 colonies, the population estimated about 2,000, where we get baseline serology and we get antibodies at mid-season, at the end of the season as well, and get baseline throat and nasal swabs, follow the children, adults in the study, and if they have signs and symptoms of COVID-19, they get swabbed. And when there's a cluster of cases, all colony members get nasal and throat swabs, whether they're symptomatic or not, which will allow us really to carefully look at transmission, asymptomatic, symptomatic transmission, and transmission from children to other children and to adults. So with this sort of design, we'll be able to look at the protective effect of COVID-19 antibodies. We'll be able to look at this correlation both at the individual level and the community level. Is there a threshold of antibodies in a population that stops transmission? So is there a herd effect? We'll also look at the role of children, as I mentioned, in transmission. We'll look at individual viral loads and transmission in children and adults, look at the effect of physical distancing and mask use to the extent that there's variability of these practices in various colonies, look at influenza and temporal immunity. In other words, does infection with influenza have some sort of protection on subsequent infection with COVID-19, and we'll also look at the molecular epidemiology of SARS-CoV-2. And many of these questions, in particular those about the correlates of protection, are very important as the COVID-19 vaccines get rolled out. So it'll be important to find out how we can make optimal use of strategies for vaccinating the population. So this slide just is a summary of the investigators on this team and the staff, and our gratitude to CIHR for funding the study. Thank you very much.